and now we're going to hear again from Dr. Colby from the University of Tennessee.
Okay, so I get another try to make sure my technology, I do better with getting this launched. Let's see how I do. Okay, so I'm going to be talking about the development and validation of the Readiness to Change survey. I hope that as you're seeing all of these tools, you'll see how they fit together kind of in a puzzle or lock and key, that you will be collecting data from one source about a certain topic, and then another tool may be used to help you understand that or to see options that you can use. Well, this is a very similar tool. The other thing that hopefully you're noticing is some patterns in how we are validating our work. So before I get started, I want to take this opportunity to do a very special thank you. As you've heard these numbers from our sample sizes alone, and remember that our community were partners throughout our work. I can't talk about this without that acknowledgement that none of this would be possible if it was not for our amazing partners across the board. So our community of students and our researchers and our extension professionals all working together, I thank you. I also want to do a special thank you to some of my doctoral students who worked really, really hard. And a lot of the research that's being presented today is really their work that they put into this project. And it shows years of commitment and caring. So as you've heard from Chelsea a number of times today, but Dr. Allison, Dr. Kristen Rigsby, Dr. Sneldra Wiggins, Dr. Elizabeth Hall, and Dr. Morgan Sowers. And I just want to say thank you for taking this journey with us. So again, we're talking about college and health. And as what you may have heard, college and poor eating habits and other negative health-related behaviors are unfortunately associated. So we do need more successful interventions, and interventions tend to be more successful and sustainable when the community supports these interventions and are involved, and that's why we use CBPR, and also if there are campus-wide initiatives that are involved. A little bit of behavioral theory here. When the 6 stages of change, and the health-related behavior change theory, since we're trying to change behaviors ultimately, remember it's a key construct in the trans-theoretical model. Well, these models were used to develop this readiness for change. It was a very appropriate fit. So another thing that you want to think about as you do develop programs, research or programs or evaluations, we want to understand the students' perceptions, again, about their stage of change and their readiness for change. But there were not tools out there at the time that would assess those factors. So we wanted to develop a tool that would help us determine how college students rate their own readiness for change, as well as how students would rate their perception of administrators' readiness for change, and also how they would rate their perception of their peers' readiness to change. So the aim of the study was to develop and validate a tool to assess perceived readiness to change in college students, as well as their assessment of their readiness to change in their administrators and peers on campus. The first step, questionnaire development. So we were developing those questions. Again, we had an expert panel, and initially we had 28 items in that survey that were based on literature review. We went through content validation, at which point that came down to 15 items, and they were in a 5-point Likert scale that ranged from strongly agree to strongly disagree. So next, step 2, again, hopefully this is looking familiar. We did content validation. So every time you change a tool or you develop a tool, every step you want to be talking with experts and with community members to do face validation to make sure you have a tool that's actually going to work for your population. So in the content validation process, we asked our experts, who here in this case, we had registered dietitians. We had 5 registered dietitians, nutritionists, and they first took the survey, and then we did cognitive interviews with them to find out why they selected what they selected, how they interpreted the questions, what they thought about the questions, and if they thought that the content of the survey was if we were meeting our goals. After that, of course, we're going to do some face validation. So we did cognitive interviews with college students. We also did them with administrators and faculty members. And after this stage, we were down to a 10-item tool. Then it was time to work on some internal structure and consistency. So this is where you get that very large sample size. We had college students, 7,419 from 60 universities, completed the Readiness to Change tool. So for the internal structure, the sample was, again, split in half using a random selection process. And then, of course, first we do exploratory factor analysis. And I have to say, actually, I think out of all the different statistical assessment tools out there, I think factor analysis is my favorite. I realize that's to have a favorite statistical approach may sound funny, but I enjoy factor analysis a lot. It's a lot of fun. So if you haven't done it, I encourage you to investigate it. It really is. It's an interesting and fun process. So we use Max rotation, Kaiser normalization that we performed on that first split group. And we saw that a 3-factor solution emerged. And our factor loadings for those 10 items, they range from about 0.53, which is not bad, to 0.84. Which is good. And confirmatory factor analysis, we then completed on that second half of the split group. And we used that 3-factor solution was then confirmed in there. And with using that fixed number of factors that had emerged from the exploratory factor analysis. So we had factor loadings, again, just to reiterate, for our 10 items. From the exploratory, it was 0.53 to 0.84, and then for our confirmatory, it was 0.64 to 0.84. And after we completed that exploratory and confirmatory factor analysis process, the internal consistency was then tested with the group of questions and that loaded onto each factor, as well as with the overall 10-item tool. And the Cronbach alpha was calculated for each group as well as the 10-item overall, and we were found good internal structure and consistency. Here, just so you can see what questions, it's only 10 item. It's not too bad. And you can also see how people responded with it there. So for question 1, my school's administration values promoting health and wellness. You can see that people are more on the positive side here. There are not as many people who disagree and strongly disagree, although we do have a lot who are in that neither range. But we're definitely on the positive side there, which is I hope our administrators are like hearing that the students feel like they are ready to promote health and wellness. Wellness programs are a good investment because they improve student health. So here we can see that the students very much were in agreement with that. The next question, students are committed to improving their health and wellness. And here's where you see a little bit more in the middle, not as strong, that they feel like others already. This one was, I am interested in working with other individuals and or groups to help make the healthy choice the easy choice on campus. And again, we see that pull toward the positive for the strongly agree and agree. I feel that my university is interested in making improvements when needed. This one is a little less on the positive side than some of the others. You know, you're a little bit more to that agree and then the neither agree or disagree side. So an opportunity to make some improvements there. I have the ability to work with others, individuals, and or groups to improve health promotion resources. So again, you're seeing that a little bit more in the neither agree nor disagree side. So we have more room for improvement there. We're almost done. Wellness programs are a good investment made by universities because they improve student academic success. And you can see that students definitely agreed with that overall. I'm willing to dedicate a percentage of my time to working with other individuals and or groups to help make the healthy choice the easy choice on campus. And again, it's at least on the positive side, but it's not as strongly positive. If my campus develops more health and wellness programming, students will use them. This is a pretty strong statement of yes, the students are ready for these kinds of changes. And the last question, I have the power to influence how resources on campus are allocated to help promote health and wellness. And here we see that there's definitely room to help students feel a little bit more empowered to make these changes. So the overall internal consistency, the Cronbach alpha, you can see it was nice and strong, 0.72, 0.80, 0.82, 0.87. So it really held up well. So this readiness to change tool was found to be reliable and valid measure of college students' readiness to change and that of their campus community, administration, and peers. And it can be used by university administrators or other health promotion organizations to better understand and what to target for the wellness programming on their college campuses and to help improve the health of our college students overall. Here are references, and I'd be glad to take your questions.